I've been treating chronic fatigue syndrome and fibromyalgia in the clinic for over 30 years. This February, unfortunately, I developed viral meningitis, and the symptoms were an excruciating 5-day headache, fever, coughing, and tremendous brain fog. I could barely lift my head above lying down. And then I had three relapses. At least two of them were brought about by exercise, and one was brought about by stress. And so the standard Western medicine approach is, well, you have post-viral syndrome, chronic fatigue syndrome. Hopefully in a year, you'll get better. The natural medicine approach, which I adopted, luckily, is, well, let's test you for virus and other infections. Let's see what your hormonal status, your GI function is like, your mitochondrial function, and maybe we can address these things through the use of hormonal therapy, detoxification, and maybe some nutrition, including IV nutrients. I recently produced a documentary on long COVID and chronic fatigue where I discussed some of the remedies I'm taking. So let's have a look. If you enjoyed this video, please be sure to like and subscribe to our channel for more videos like this, and be sure to hit the alert button to be notified of new videos each week. And now we're going to talk about some remedies used for chronic fatigue syndrome and long COVID. The first is aromatherapy, which could be applied topically. So I want to remind you that herbs and nutrients can be used topically as well as internally, and sometimes by IV too. And I'm placing my aromatherapy over a famous acupuncture point for nausea and vomiting. The next is a superstar for long COVID and chronic fatigue syndrome, and it's called glutathione. And I take glutathione in liposomal form. That is, liposomal helps it integrate into the body better, and I hold it in my mouth for about 30 seconds before I swallow. Now, glutathione is anti-inflammatory, it's energizing, it's also useful for liver detoxification. And like I said, it's my number one choice of a remedy for long COVID or chronic fatigue syndrome. And glutathione can be built up by using liposomal glutathione, taking the supplement NAC, or by taking whey protein. So every day I take whey protein in my smoothie. It's good to take about 20 to 25 grams a day. Again, it could be just mixed into a smoothie. I have a friend who mixes it into his tea every morning, so it tastes pretty neutral. And glutathione is energizing, promotes the immune system, and helps build glutathione in the body. The next one I want to talk about is saffron. And saffron is one of the most beautiful ingredients. And also, it's one of the most promising in terms of a food, a dietary supplement, as a medicine. And it's predominantly used for brain health. The next one, which has a very similar color, is I take these gummies with phosphatidylserine, oftentimes abbreviated as PS, and this is a great ingredient for brain fog and brain health, and also mental fatigue, energizing the body. And I find this formula effective within about 5 or 10 minutes. Probably my second most recommended supplement for long COVID and chronic fatigue syndrome is the supplement SAMe. It's a type of methionine. It's actually been used for 30 to 40 years in the United States and Europe as a treatment for chronic pain, depression, and also brain health and immune benefits. So SAMe is one of the best ones. And several of my patients with long COVID, such as Jenny and also Regina, found that SAMe was very effective, sometimes within a few days after taking it. Next, I want to talk about CoQ10, and this is also known as coenzyme Q10. And this is an ingredient that is very good for cardiovascular health, good for immune health, and also supports the body's energy system. And so I like CoQ10. I like the chewable type. So I actually take a chewable type of CoQ10 and find that very energizing. Use chewable so it absorbs better into the system. One of the key take-home messages, though, about CoQ10 is that there are some brands, particularly the cheaper brands, that are not absorbable. And so the dosage of CoQ10 is very, very crucial to getting results. And so that's why I recommend using CoQ10 and these other remedies under a health professional's guidance. And the final one I want to talk about is my good friend ginseng. Ginseng is one of the most misunderstood herbs. Ginseng is actually very, very beneficial. However, it should always be combined with other herbs. So I take ginseng for energy just about every day. I also use it as a coffee substitute, but I'm always combining it with other herbs depending upon what's going on. So these are some of the treatments I've been taking. In closing, I'd like to reinforce the idea that if I could only have one supplement or herb for chronic fatigue syndrome, it would be SAMe. And I discuss SAMe in some of our other videos. Let us know what you think. We'd love to hear from you. If you enjoyed this video, please be sure to like and subscribe to our channel for more videos like this, and be sure to hit the alert button to be notified of new videos each week.